All right, welcome everyone. We are going to let folks join just for another couple of minutes. We know Zoom can sometimes take a little bit. Zoom can sometimes take a minute to get going, so we will get going in 1 second. But while we're waiting for folks to join, please feel free to introduce yourself in the chat with your name, organizational affiliation, if applicable, and your pronouns if you're comfortable. All right, welcome everyone. Thank you for joining us for Strengthening Community-Led Food System Work, one of the sessions in the Mass Food System Collaborative's 2021 Forum. Of course, we'd hoped that we would all be together in person this year, but it's great to see so many of you here, and we're looking forward to a good discussion. My name is Becca Miller. I'm your facilitator today, and I'm a program manager at the collaborative focusing on the Campaign for Healthy Incentives program funding, the Urban Ag Coalition, and a couple of other projects that some of you work with me on. This year's forum is an opportunity to look broadly at how various parts of the food system intersect and support one another, how sometimes they put pressure on one another, and how all of our work can help the local food system be more sustainable, equitable, and resilient. We hope that these sessions will add to your thinking about the issues we discuss, their connections to your work, and about how we can all work more collaboratively towards our shared goals. We especially like to thank our sponsors listed here on this slide for their support, which has allowed us to keep forum registration free for everyone this year. A couple quick housekeeping reminders. Please keep yourself on mute during the presentation. Introduce yourself in the chat if you'd like with your name, organization, and preferred pronouns if you're comfortable. Please use the chat for questions at any time to the group, and we will be recording the session to post online on our YouTube channel that will be uploaded shortly after the presentation. Following the presentation, there will be breakout sessions to give us all an opportunity to network a little bit and consider some of what we've learned. So we hope you can stay for those conversations. And today's agenda. So right now we're in the welcome. Then we will hear from each of our panelists for about 15 minutes about their work and how it's been led by the community and how they've adapted it during the pandemic. We will do some question and answer. So again, feel free to put your questions for the group in the chat box. Then we'll do about 20 minutes for breakout rooms for you to consider what you've learned today and how it applies to your own work. Then we will close out. So without further ado, I will turn it over to Casey Burns, Director of the Coalition for Healthy Greater Worcester, for you to talk about your work. Casey, take it away.
Yeah, thanks so much, everyone. I'm Casey Burns, as Becca introduced, Director of the Coalition for Healthy Greater Worcester. We're also the Chana 8 Community Health Network Area 8 here in Worcester and Central Mass, and where our agency is primarily responsible for public engagement, community engagement, capacity building, assessment, strategic planning around public health. However, my background is in food security. So I've came to this role at the coalition about 4 years ago. But previous to that, I was the director of programs for the Regional Environmental Council here in Worcester, and helped develop the city's farmers market programs, SNAP access, community and school gardens, and youth urban agriculture programs. And so in bringing in kind of transitioning to this role at the coalition, I really sought to be able to use the experience doing community-based program development and policy implications to this more broad lens of public health work. I should also mention I was a founding member of the Worcester Food Policy Council about 15 years ago now, I think maybe just shy of 15 years ago, at my role at the coalition, have remained doing that work. And so try to centralize work around food security whenever I can, even though the work that I'm doing now has kind of this very broad definition of health, including economic opportunity, municipal racial equity policies, mental health, substance use work, physical activity, and access to healthcare. But we're going to talk about food access and security, so happy to do that here. And so I wanted to talk a little bit about kind of the transition pre, during, and post heavy quote marks, pandemic and kind of impact on our collaborative community food work. You know, at the Regional Environmental Council as Director of Programs, that's one organization's work, but really is just one small piece of this broader network of emergency food providers, community cultural organizations, business owners, policymakers, healthcare institutions that make up the kind of ecosystem in Worcester and everywhere of community food or nutrition food security work. And so pre-pandemic, the Worcester Food Policy Council was established pretty early on, I think, in the movement of this work. I'll say maybe 2005, 2006. This is like throwing out years that I might be wrong on, so forgive me if someone knows. But, you know, pretty early on in the establishment, and I want to highlight that because I think that some of the successes we're able to have now is because we had this foundational structure to build on, to learn from our mistakes with, that has really enables us to like propel forward in our equity-based food work. For the kind of early years of the Food Policy Council, we were actually a direct advisory council to the mayor, and worked on the urban ag ordinance for the city of Worcester. We were kind of early advocates for the healthy incentives program and breakfast after the bell. In the years of the Food Policy Council went on, they began to see a kind of more like a deeper connection and a need in order to be able to have kind of more broad advocacy priority areas that included the fight for 15 and housing equity in Worcester, because we see that if, you know, this is so much of the burden of people's, you know, income is going towards housing or, you know, isn't there, then that's just, you know, increasing food security, and we're not able to kind of solve or even policy our way these out of these kind of driving economic and social determinants, foundational inequities. And so the Food Policy Council really drove a lot of those initiatives in Worcester, and I think made a lot of progress in bringing folks together. However, we didn't have always the infrastructure in order to be able to deeply engage community members as who had lived experience as policy committee members, as advocates, as decision makers in the work. And so had tried kind of, I think, various different ways of stipending and new partnerships in order to be able to develop that. But I think, you know, honestly, always struggled with that through, you know, many of the years of the Food Policy Council. I think the biggest breakthrough that they made in there, as I was saying, is this kind of broader definition of the driving inequities. And I think was able to make much more powerful relationships with community members who were identifying housing and income access, and I should mention childcare as being kind of like the forefront of their concerns. And so when the pandemic happened, the Food Policy Council quickly transitioned with the manager who was in place at the time, Martha Estefa, really did an incredible amount of work developing that, to really quickly pivot to how can we plug in to emergency food needs that were really stressed throughout the pandemic, as I'm sure many of you did. And we transitioned, because the Policy Council was so much policy focused in the past, we kind of transitioned and combined efforts with a COVID emergency response coalition that was developed called Worcester Together, which it developed an emergency food group to bring providers together on a much more programmatic scale to have the very practical decisions of, hey, people who are utilizing food banks can't get to them if they're quarantining, or they can't safely be able to enter spaces to be able to pick things up if they don't have public transportation, or if the public transportation is unsafe. And so how do we negotiate and have conversations between providers of, where there are delivery options or how we can utilize volunteers to plug into those resources needed. We also identified a really critical need in our community, which was that people who were quarantining, who were COVID positive, were essentially blocked off from all food resources. And these are people who were sick because they had COVID, and also had the potential of spreading the virus through having to go out of their house or having household members go out of their house. And this became spotlighted when a rooming house in Worcester had a COVID outbreak very early on. And we said, what are we going to do? People were largely dependent on kind of public resources to get their nutritional needs met. And so this group of emergency food providers that had kind of combined with the Worcester Food Policy Council for emergency response looked at and said, we need to develop a program to address this. And so I just like to tell this because I feel like it's a good like practical reminder that folks kind of like hemmed and hawed a lot and said, should we do a survey of restaurants of who would be willing to participate in this? And should we, consider taxi delivery options like they were doing in New York or blah, 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 or like seeing these like cool models emerging. And I think a few of us looked and said, do we have money for this? A few funders were ready and willing, to be able to support this initiative. So we said, if we pay the restaurants and we pay a delivery agency, they will make the food. We don't have to do a survey. Let's just partner and move forward. And so we approached the Maine South Business Association, which is a small business association located in the neighborhood of Maine South, which is one of the highest crime rate neighborhoods. There's also a predominant Latinx, Southeast Asian, and kind of a gateway neighborhood for new immigrants and refugees, who had this incredible network of restaurants with kind of a variety of cultural specialties, who were suffering through the pandemic as well, as we all know, and asked and had a discussion with the business association of could we rally together a group of restaurants, agree on a price point and a delivery mechanism. And we were able to very quickly put together a program where we were able to get referrals from the contact tracers and the testing sites, the community Stop the Spread community testing sites, and then be able to use our family resource capacity to reach out to folks, screen them, and enroll them in what we call the Hot Meals Delivery Program, which we were able to resource to be able to provide for anybody who was referred to it, one hot meal delivered from a restaurant, a participating restaurant of their choice, for every household member, for at least a week. So people were enrolled in a week. So if you had 10 people in your household, even though if one or two had only tested positive, we worked with a delivery service that could deliver those meals right to their household, to their doorstep, and they, with a no contact delivery mechanism. And we found through kind of our data that collected some of the quantitative data as well as storytelling of the qualitative data, the incredible impact that this had from both community members and from restaurants who were able to benefit from this resource. We also got some additional funding to be able to deliver cleaning supplies and thermometers and some PPE. And this included early in the days of the pandemic, getting a volunteer to drive to Gloucester to a distillery and buy 10 gallons of homemade or like distillery made sanitizer and pour it into little bottles and deliver it. So really creative community kind of solutions be able to contribute to make this a really powerful, impactful program. And to date, we've delivered over 30,000 meals to people and paid restaurants $10 per meal, paid the delivery agency, paid for PPE. For that. And so we know, our small business owners did not have to carry the burden of that as well. We, just a tale, we didn't get, city support. We did eventually get some CDBG, community development block funding from the city, but not until the very beginning of 2021. And so we really saw an incredible lag in the state and even city response for supporting this. And we otherwise had to pull together funding from private funders that was fundraised through this Worcester Together initiative, as well as from the Worcester County Food Bank, who was able to step in and really critically support this program. We're still delivering and still running the program, and we have CDBG funding run through the end of March. And I just talked to the person who's making those referrals right now, and we were up to 85 referrals a day as of yesterday. So still seeing an incredible need in our community. And so the other thing, I know I'm running out of time, that I wanted to quickly mention is that one of the things that I think we were able to loop back with, we started with the policy council, moved into program. And I think one of the most powerful things we've been able to do is then look back to policy and say, now that we have this rich community programmatic experience of what happens, what was, particularly stressed and spotlighted through the pandemic, and how do we use that mechanism in order to be able to drive the policy initiatives with this infrastructure of the Food Policy Council moving forward. And so we were able to actually, through our partnership with Central West Justice Center, which is a subsidiary of Community Legal Aid, actually write 2 pieces of legislation to help to capture this experience and put this forward. And one was a program, an act to support the restaurant industry and food security. I can't remember what it's called exactly, something like that. And it was an act that would require the DTA to opt into the restaurant meals program, which is already a federally established option where the DTA can expand SNAP access to for homeless or unstably housed senior and disabled communities to be able to use their SNAP benefits at participating restaurants. We saw through the pandemic, people are sick with COVID, they need prepared meals. People are sick with other conditions outside of the pandemic, or they don't have kitchen equipment, or they can't, get to the resources themselves. And so how can we use that experience and this momentum that was built to now loop in and pilot this initiative in Worcester for the state with the restaurants we already have built this incredible relationship with. I know I'd be interested to hear from others, but I know from us, that's been one of the hardest barriers to break through, is how do we make a meaningful relationship with business owners who don't have in their normal scope going to a meeting or advocacy. And this has been a really meaningful way we've been able to do that. And we've actually had those restaurant owners participate in our statewide hearing to advocate for, to write letters, to do video testimonies, and really join us in this movement and effort. The other one was a requirement that the DTA would have to engage in a community engaged process before closing or relocating a physical office, also built on the experience we had through COVID. And as a way to say, because we saw the Worcester location of the DTA moved way out of town and the outskirts of town from downtown. So for those requiring public transportation had to, move a much farther distance, a much more time to be able to get to it. And we saw the Plymouth office close during the pandemic. And so with no community engaged process of what that means, what impact that has on folks, and how that could potentially disrupt their benefits. And so we were actually able to engage through this network we had established with emergency food providers, people to test out and pilot can I ride the bus from my house to the new DTA location? They actually videoed their journey and took notes on, I changed this bus here and I walked half a mile with no sidewalk here. And this was my experience when I got to the door. And we also submitted that to the state hearing and really incredibly strengthened our advocacy for that piece of legislation. And so I think we're just really looking at how do we sustain and capitalize on what we've learned in order to be able to move forward in a much more equitable direction in our kind of prioritization and advocacy engagement moving forward. And so last thing, I'm out of time, but just wanted to say that the this emergency task force has now transitioned. We actually petitioned the city of Worcester to adopt this committee as the mayor's task force on food security, so that we can sustain this infrastructure, so it can work in partnership with the Worcester Food Policy Council as the policy partner and arm on it, to be able to continue to do this kind of coordination of programs and services and allow the expertise to differentiate a little bit. And so we have been adopted by that and are really excited about this, and we're hoping has potential to kind of give us a formalized space to make recommendations for things like ARPA funding or other things, as like the go-to body, experts in the room to be able to get advice from when deciding on resource allocation. And thank you so much.
Awesome. Thank you so much, Casey. Right on time. Next, we're going to go to Sarah Primeau and Rick Henry. Sarah is the Boston Program Director at Health Leads, a health equity focused nonprofit that has worked in the Boston community for more than 20 years. She is a public health social worker and has worked in the healthcare and nonprofit sector in Boston for the last 15 years. She loves to travel and spend time studying abroad in Kenya and hopes to get back to some international travel again soon. Definitely second that. Rick is a community leader at Health Leads and helps co-lead all efforts of the Neighborhood Food Action Collaborative, or Nfac, Hyde Park / Roslindale branch. He has experience in community organizing and is committed to racial and social justice. He is a father of 3 and family man, longtime Hyde Park resident and originally from Barbados. Sarah and Rick, please take it away.
Thanks so much, and thanks for having us here today. Casey, really cool stuff. I did not know all of that, so excited to follow up behind you. So as Becca said, I'm Sarah Primeau. I'm the Program Director at Health Leads for the Boston region, or Massachusetts region, and I'm joined here today by Rick. I want to just quickly give you some background on Health Leads and who we are. So as Becca was actually just saying, we say that we're an innovation hub that partners with communities and healthcare systems to really unearth and address the systemic causes of inequity and disease. So we do this by trying to remove barriers that keep people from being able to identify, to access, and to choose the resources that they need to live a healthy life. So in Massachusetts right now, we are a national nonprofit, so we span the country, and our efforts in Massachusetts are really based on food security. Our work is really tied to the 4 pillars of food security. So that's around availability, access, utilization, and stability. And we're primarily focused on Boston at this time, hoping to expand further, but starting small. And today we're going to talk a little bit about a specific effort that we're doing, not everything. And I'll pass it over to Rick to do a quick intro.
Hi, everyone. My name is Rick Henry. Community leader at Health Leads and with our Neighborhood Food Action Collaborative, Nfac. I live in the city of Hyde Park. As you know, pandemic-related food insecurity hit Boston families really, really hard. Food security has gotten really bad in Boston. Community members have lost their jobs, laid off, suddenly unable to feed their families. I think the numbers, if you look at the numbers, food insecurity, since COVID began, there are at least 300,000 people, more people in Boston who can't get food. I think this actually means that 1 in 8 adults and 1 in 5 children are food insecure. COVID-19 has disproportionately harmed vulnerable communities in Boston and is concentrated in the Latinx and Black communities. In Boston, specifically in Hyde Park, where I live, there were not many food service programs available for those that are affected most as unemployment rose and social services broke down. More Boston residents than ever were struggling to access essential resources, which are very, very limited. One of the most significant gaps then and right now is food access. Low-income Boston residents also report using the majority of income on housing costs, which leads to resources for other needs such as nutritious food. Some people have to try to decide, whether to pay a bill or buy some groceries. But that's just the way it is in Massachusetts. I'll come back to that. Sarah?
Yeah, thanks, Rick. So as Rick described, I think everybody on this call, we all know that food security was a major need in Massachusetts before the pandemic. And now with COVID-19, it even further fractured all of our systems and deepened a lot of the inequalities that we were seeing. So I just want to take a second to tell you about health leads and where we were and where we are now. So back in September of 2020, the city of Boston actually came to us, the mayor's office, asking us if we could assist in gathering some community input for really to assess the community needs based around food security at the time. So what were the food resources? What was going on in the city? And as a result of that, Health Leads, we led what was called the Equitable Boston Food Ecosystem. I never say it without getting my tongue twisted. So EBFE, it's a community engagement process where we brought together more than 100 community residents, nonprofits, government officials, academia, a whole group of people throughout the city. And what we did was we actually wrote up recommendations, and those recommendations were used to inform the mayor's food access agenda for 2021-2023. So out of that whole process, some of the biggest themes that we did hear from the group, and I don't think these are new to anybody, were things like we need to improve affordability and access of healthy and fresh food. We need to increase culturally diverse food products that are available, increasing public awareness, such as what food resources are actually out there, also public benefits. What can I apply to? How do I apply? Can I get help applying? And I will say the biggest thing that we heard out of all of this entire process was really the support that community members wanted for community-led solutions. So we heard this very loud and clear that community residents really wanted a seat at the decision-making table. And they wanted much more localized neighborhood-specific food security work. So rather than doing the entire city of Boston, really focusing on each neighborhood for their specific needs and working within that geographic area, also contributing to the entire ecosystem in Boston. So this is essentially how the Neighborhood Food Action Collaborative was born. We call it the Nfac. And what we do is we use a really hyper-local, community-led approach to design equitable solutions to address food security. We have two groups right now. So we call them like two hubs, two groups. One's in Hyde Park and Rosendale, and then the other one's in 3 other neighborhoods of Boston. So Dorchester, Mattapan, and Roxbury. And the overall aim of the Nfac is really to create solutions for a more robust and accessible food system, which there's a lot of different aims within each group, but I'll go into that in 1 second. So what's so unique about Nfac, and I think probably one of the biggest things I wanted to talk about today, really is that the key to solving food insecurity in our minds and in the work that we're doing is really enabling those who already know what works to enact change. So really elevating those who understand the challenges and the barriers to food security firsthand, and then giving them the flexibility to determine the solutions, to really design the solutions for their own specific community, and so that they can be fully involved in the process. So we started, about a year ago, as a really small group. We were comprised of mostly community members that we had actually met out at existing food programs, as well as a few local community-based organizations. And when we started, the city had actually asked us to focus on Hyde Park specifically because there were so few, community-based organizations and groups there in that geographic area. And then also because COVID-19 cases were much higher, as was food insecurity in that specific neighborhood. So we did focus in on Hyde Park and then expanded to neighboring communities. So within the first few meetings, the group, they came together, they got to know each other, they established community agreements. And these agreements, I'll share them at the end of our presentation. It's really just a shared set of expectations that really explain how we want to show up and the space that we want to set for really authentic dialogue with one another. So they set those up. We also began the practice of compensating community members for their time at a rate of $25 an hour. This is a big thing for us as well. We feel like Nfac members, they provide expertise and they contribute to food security solutions in really meaningful ways. And this work takes time commitment, and on an ongoing basis. You know, it's a lot of work. And so based on principles of equity, you know, we really thought it was important that they were compensated just like other staff members from CBOs and other organizations who were also part of this work. I'm going to pass it back to Rick, who can go a little bit more into what the group has actually been working on.
Thanks, Sarah. So in our first meetings, we asked folks, you know, one of the questions we asked was, why do you want to be at this meeting? You know, why are you here? What do you want to be here? And we got a lot of great answers. I know for me, after realizing the dire need, food insecurity in my community, you know, it's simple for me that the community had to step up and not just create an awareness about food insecurity, but also create some kind of a service to assist in keeping our community healthy and alive. You know, I wanted to be a part of actions that benefit the community in real time. You know, I've done a lot of organizing before, but you know, as we heard earlier, you know, sometimes you take you know 2 steps forward or 1 step forward and 2 steps backward. Too much negotiating, too much bureaucracy. You know, I just like to see things happen, especially when they're really, really needed. After all, I think that the ability to eat healthy food is a human right, not some kind of a luxury or something. You know, places like Massachusetts that has so many resources, it's really a shame that people have to go without food. In the group, we discussed what we would like to come from these meetings, and each person get to express their ideas through polls. We did breakout rooms, group discussions, and one-to-one discussions and post-meeting surveys, that kind of stuff. Some of the individual reasons they said they wanted to join this group were things like, you know, people wanted to help family and friends access food. They needed food for themselves. They wanted to be connected to other programs so they can better coordinate. One of the things we do is we have a food resource guide that is updated every week, where we share with folks because like our pop-up, which started as just a pop-up, it turned out, you know, back in May, and we're still doing it every week, but we only do it 1 day per week physically. The rest of the week, we're trying to find money, trying to do some fundraising, trying to get some grants, trying to help other organizations get food to their programs. Some of our individual goals, for what we wanted to accomplish as a group, some of the goals were things like program improvement, and not necessarily creating new programs, but coordinating efforts to making them stronger, improve access to food resources, a place where people can access a local food resource in their community, and so on. In one of the first of our several meetings, we looked at the population we wanted to focus on and what our aims would be. We voted as a group that we wanted to focus on lower income and unemployed people. Aims we came up with were, you know, we wanted to improve access to fresh fruit and vegetables. This was the biggest thing for our community. Affordable access was extremely important at the time. It still is right now, even before COVID. We did some research and thought a lot about public benefits that can help people who are food insecure. And Sarah and Healthly's team showed us data for the Hyde Park and Rosendale, and that there were many people who were likely eligible and not getting SNAP benefits. So we decided to set our aim to improve education awareness and application process help. Last, but probably the most important, we wanted to improve coordination and collaboration of all food security efforts in both our neighborhoods, Hyde Park and Rosendale. We wanted to be able to talk to each other and work together. It is to, you know, makes things easier when we communicate, when organizations work together. You know, even if they're working on slightly different things, at the end of the day, it's all connected. So where are we now? in a short time together, almost a year now, we've done some pretty cool things that I'm pretty proud of. We created a Hyde Park pop-up. This has been going on since May, and we serve over 120 residents each week. We get our fresh fruit and vegetables and other fruit that is culturally appropriate, and the population is mostly Haitian American. We also provide resource information at these events. We even brought out the vaccine van a couple of times. We got people tested and vaccinated. You know, so like Sarah said, this is really, really hard work, and I'm happy and proud to work hard to serve my community that I live in. So we've opened our communication channels, and different groups are talking to each other. For instance, F1 program has access food 1 week. We're able to reach out to the other Nfac orgs who may need food that week and help coordinate. We also bring access food to our distributors, from our distributors to the community fridges throughout Boston neighborhoods. We develop a comprehensive food resource guide that's updated weekly. And the city of Boston also puts it on their website. And we are starting a new SNAP enrollment program this month. We realize that there are too many people who are eligible for SNAP and other programs who haven't even been applied because of the tedious process. We hired 2 community leaders to lead this work, myself being one of these people. And if nothing else, we've created a safe space for neighborhood residents to engage in a solution and have their voices and needs heard. Thank you. Back to you, Sarah.
Thanks, Rick. So I know we are at time. I just want to leave you with, I guess, four quick points about the lessons that we've learned throughout this process and what we're doing now. So number one would be just throughout this process, it's been very clear that organizations and individual residents care very deeply about providing food to their communities. There's so much energy that has been put into creating program and access channels. But what is often missing from a lot of these efforts is the involvement of community members. So we have found that community involvement is key throughout the entire process. Second is just that dignity is crucial. Being food insecure has a real way of making you feel less than, especially when it comes to be asking for help. So, historically, people often associated food insecurity with a moral failure. And now, especially with the pandemic, this is just not true. It's a huge misconception. So for Nfac, we're at least trying to reclaim some of that dignity that can be lost, making it possible for community members to really decide about the solutions that they want to have, and allowing them to have the voice that can be heard. And then third and final, I would just say, throughout this process, we've learned that the road to community ownership and empowerment takes time. Strategies that really mitigate power dynamics and raising up the voice of community members and creating space. It takes time and thoughtful engagement and a lot of intentionality. So we do understand that, and it's not necessarily the quickest and the easiest route, but it is what will make solutions sustainable in the long run. So thank you all very much, and look forward to hearing some of your feedback later on.
Sarah, do you want to share?
Can I just leave you with something real quick that I always say to my folk throughout volunteers, the entire community? I would say if everyone does a little, no one has to do a lot, right? All this work to be done, and we're always complaining, because it is a lot of work. But if everyone picks up a little bit of that, then no one has to do a lot. Thank you.
Many hands make light work, as the old saying used to go. Sarah, do you want me to show the slides? We have 1 minute for that if you.
Oh, sure. Real quick, we can pop it up. We just wanted to show you. So this is our team, just to put a little visual to who we are. And those are all the organizations that are a part of the Nfac Hyde Park Rosendale group. So yep. And then the second slide we have is just our community agreements. These are really just, what we go through every other week when we have a meeting. We make sure to go over our values and our agreements and to raise up what we're going to focus on that day. Thanks, everyone. Really appreciate it.
Awesome. Thank you for allowing me to share those. Next, we will jump over to Caitlin Marquis, Program Manager for Healthy Hampshire, and Kia Aoki, a resident leader with the Food Policy Council. Caitlin and Kia, take it away.
Hi, everyone. My name is Kia, and I'm one of those community members that you will want to talk to. So, yeah, so I am a non-professional, and I've been involved with forming the Hampshire County Food Policy Council for the past couple of years. And working to help start the Food Policy Council in Hampshire County has given me a real sense of control over my own circumstances. This has happened because there was a group of professionals working with a nonprofit in Hampshire County that invited me to join with them to work on a project to address problems in the food system and to engage community members with the kind of lived experiences that they wanted to help. The Hampshire County Food Policy Council is being set up to do just that. This has led to a real collaboration between professionals already involved in this work and community members interested in working with them and on projects to improve the system. There is real equity in the need for help and information from one another. For the first time in a very long time, I have a group of wonderful people that really care about fixing what's broken, and I feel respected and listened to. And just for some background, this is a far cry from where I had been just a few years ago. In my distant past, I had 2 successful careers and never had to worry about money or food. After a few traumatic events that happened close together in a short amount of time, I found myself homeless with 2 young boys in a new state and desperate. And in seeking help, I discovered that there was this preconceived notion that I was completely responsible for my circumstances, my predicament. And the reason for that was because I behaved badly. I was abusing drugs, alcohol, and even abusing my own kids. I felt wrongly judged and humiliated because that wasn't my reality. And I ended up really depressed and on disability as a result of all of that mess. But fast forward 15 years and coming out on the other side of all of that, recovering from depression, getting my kids through school and off on their own, I was given the opportunity for having a raised bed in a community garden in my housing complex. I live in public housing, and building the community garden in Hampshire Heights. It was the local hospital and the nonprofit that wanted to build that for the community members so we would have stuff to eat. So this was in 2019. And this started me on this journey that building the garden from working very closely with these people doing this kind of work. And it evolved into starting the Food Policy Council that they asked me to come in and do that with them. And so this is where my lived experience has given me tremendous insight into the brutal inequities in the food system, how we get proper needed nutrition when income is terrible. And there was a real commitment in the council to the idea of moving power to the people with the experience to know it needs to be fixed, like issues that come up that only we can understand, and to listen to us as we help suggest policy changes, different ideas about access and economic factors. And the professionals are providing resources, expertise, and knowledge of working within existing systems to make stuff happen. There was a real collaboration based on equity of need, and it's beautiful, but it's not always easy, and it hasn't always been easy. And along the way, we chose a governance structure that took more than a year to figure out. There were conflicts with people that had a difficult time with the idea of sharing power, or never seemed to agree on anything and spent more time being disruptive instead of cooperative. But in the end, we landed with a wonderful, diverse collection of intelligent and empathetic people that share values and see a great mission in what we are doing. But on a personal note, my life has been completely transformed by working with this group of people, and it's hard to put into language how dramatic the change has been. The work that the Food Policy Council can potentially do depends on this collaboration, and the respect I have been given, the knowledge that I am listened to, and the feeling that my experience and my contributions are valuable, which it has just given me such joy and so much enthusiasm for the work ahead. I also have hope for the future, a sense that the way this project has been set up is capable and flexible enough to tackle pretty much almost anything from the most pressing needs of the community while giving them the power to make the changes that they would like to see, because they are fixing problems that affect them directly and using their own solutions to make that happen. So there's so much I can say about this, but the point of forming and creating a Food Policy Council is to, like one of our values is to use more community people than there are professionals, and the support for each other and the way we've grown together and the way we've come to understand and how to work together, and the trust and the love that's developed over the past year and a half is incredible. I mean, it's completely uncanny. And so we have this really solid foundation. We haven't done anything yet, but we have a really solid foundation to make things happen. And we understand how it's going to happen. We have a structure in place. We have the skeleton. We have everything we need. We have the scaffolding, like, so it goes up. And I really feel like what's coming is really, really going to be great. And, you know, a lot of this, I mean, all of this work has been done over Zoom because the pandemic happened. You know, just as we were thinking about doing something like this project, and people were talking to me, we were talking about governance, the pandemic hit and everything had to happen on Zoom. So we've done a ton of work already. And just as a side note, the way the scaffolding is set up in our Food Policy Council, we are ready to like absorb like all of the partners in Hampshire County that are involved in food access. And I work with another nonprofit called Grow Food Northampton, and I'm on their food access advisory committee. And we did so much food distribution during the pandemic and figure out how to get food to people safely, how to get them fresh food safely. And we have lots of other projects that we're working on within that group too. And we would like to bring everybody in and to have everybody have a circle on the Food Policy Council in Hampshire County. So this is where I'm at. And I love the fact that I can be a community member, but also work with professionals that care about this stuff and care about hearing about what it is that we need, you know, and give us a real seat at the table. And I mean that in the truest sense of the word. Like, I feel like I'm valuable. I feel like I'm really involved. I feel like they really care about what I think. You know, this is really important. If you want people to be interested in helping you figure out what to do because they have that experience, you really need to make sure that you value their expertise, that you value their experiences, that you value their ideas about, you know, things that need to happen in their own communities. I mean, it's really important that they feel like they're important, you know, because in so many ways, and this was addressed just a minute ago, in so many ways, people like low-income people are looked at as though like this is their lifestyle choice, that they would prefer to live off of benefits than to actually have opportunities to make their own lives what they want their lives to be. And it's just not true. You know, so if you give them the opportunity to feel like that they are valued, that you have confidence in their abilities and their intelligence, and make them feel like that they're human. I mean, just fundamentally human. You know, it's so dehumanizing to be on the other end of having to ask for benefits. It's really awful. So I want to say that I really appreciate being involved in this work, and thank you everyone for listening to my story.
Oh man, so I asked Kia whether she wanted to go first or wanted me to go first, and she said she wanted to go first, and now I'm kind of regretting it because she's such a hard act to follow. So thank you so much, Kia. Beautiful job. I always love listening to you. And that's actually the second time I've heard Kia sort of speak from this community advocate role today. She spoke at an event I was at this morning. And so just noting, you know, everybody there also, I think felt like she just did such a beautiful job. So we're so lucky to have you. But so Becca had asked us to talk about the Food Policy Council and the Amherst Mobile Market. And so I'll just talk a little bit about the Amherst Mobile Market. I know we're getting a little behind on time here. So Kia mentioned, you know, sort of some of this precursor work to establishing the Food Policy Council. I've gotten the question a lot since the start of the pandemic, like, how do you reach out and engage community, you know, when you can't be in person with people? And I always have to say, I don't really know the answer to that question, because we just did so much community engaged work leading up to the establishment of this, what's called the Food Policy Council Startup Circle that Kia's involved in. And, and so by the time we were ready to do that work, we were sort of picking from the folks who had been engaged in other projects, who had really stood out as leaders in their own community, who we thought, would be great to sort of tackle this question of how do we come together, how do we work together, which is what we've been spending a really long time on. I do just want to add to Kia's story that we are launching the Food Policy Council in January. So I just want to throw in a little celebration there, because it's really been a year and a half that we've been trying to figure out the governance structure for it. So this work takes a long time. Anyway, I'm trying to talk about the Amherst Mobile Market, which is one of the projects we worked on. And it's essentially started, probably back in 2017, I would say. We did a countywide community engaged food access assessment in partnership with Cooley Dickinson. One of the priorities coming out of that was to establish mobile markets. And a lot of the community members we engaged there were from Northampton. And based on the data, we were seeing that there were really probably a lot of community members slipping through the cracks in Amherst. And so they said to us, feels like a really huge priority to engage some of these Amherst residents in answering some of these similar questions and in this assessment work. So we ended up doing a food justice planning process just for Amherst. Over the course of the planning process, we engaged over 25 community residents who were majority people of color and majority, I would say, I think majority Spanish-speaking Latinos. And so through that process, we identified a set of priorities specifically for Amherst, including establishing a mobile market. So we kind of spun off from that group that was involved in the Amherst food justice planning process, developed an Amherst Mobile Market Planning Committee with a lot of the same residents, and engaged that group in kind of setting goals and developing a request for proposals, because we had this idea. We actually had funding to do a pilot project, but we didn't have an operator yet, like somebody who could really do the day-to-day work of managing a mobile market. So we put out this request for proposals. We got 3 responses back, and then the group chose Many Hands Farm Corps because it was just a farm that clearly was in line with the vision of really doing this in a community-led way, had really sort of tuned into the fact that the group was saying, we want to establish this mobile market, and we want the people, the residents who have been coming to the table to be the ones staffing and running this mobile market. And they were really open to that idea. So Many Hands Farm Corps got the contract. They got to work really, creating job descriptions and really, intentionally recruiting from within that group of folks who had asked for the mobile market in the first place. And so in our pilot year, there were actually 13 staff members, which was a lot. And so we kind of had these 2 different levels. There were kind of the operator level, the people who were loading and unloading and selling food and managing the iPad and things like that. And then there was these sort of community outreach folks who were just getting paid a small amount of money for the season. All of those folks were people of color. All of them were almost all of them were residents. 12 of 13 were residents of the housing complexes that the market was serving. We served 4 environmental justice communities in Amherst, and we did that pilot year, learned a ton of lessons, and then by the second year, wanted to kind of streamline, cut back on the staff a little bit. So by the second year, we really just had 4 core market staff, all of whom had been market operators in the previous year. And by the second year, they were taking on a lot more responsibility. They were, for example, going, given a debit card, and they were able to go and buy, culturally appropriate tropical fruits and things like that to supplement the local produce for the mobile market. They took on ordering from local farms. They took on, really doing a lot of the outreach and getting folks signed up for SNAP and things like that, or through SNAP and things like that. So there was really, I would say, over time, just this significant shift from, sort of just being folks coming to the table. And I would say we actually, when we initially started engaging with this group of residents, it was through a partnership with Family Outreach of Amherst. And they're a social service agency in Amherst, and they were basically just sort of hosting these monthly luncheons to bring their clients together, to socialize and to learn about different social programs and things like that. So we started our conversations, just sort of attending those lunches, starting to talk to people and saying like, hey, what do you know about food security? And, Rick, I love what you said about, food is a human right, and sort of having those conversations, helping people understand, if you're struggling to access healthy food, that's not a personal failure, that's a systemic failure. How do we look at that as a systemic failure? How do we start to find solutions to that? So starting from that place of really sort of educating around food security and food as a human right, up into this point of those same folks, involved in those conversations, really running the mobile market and making a lot of decisions about the mobile market. We still have an Amherst Mobile Market Planning Committee that sort of almost functions like the board of the initiative. It's still supported by Healthy Hampshire and Many Hands Farm Corps. We're in between seasons right now. We just got an earmark from the ARPA budget through our state rep, Mindy Dom, which will put us in a really good financial position for probably the next couple of seasons, which is great. And so we're focusing a lot of our energy right now on kind of reviewing how the last season went, thinking about lessons learned, focusing on what to do differently for next season. There's a lot I could say about challenges and struggles in this project. It's definitely not all rainbows and butterflies all the time, but I know that's one of the questions for the panelists, so I'll hold back for now and just end it there for now.
Awesome. Thank you all so much. Just a quick round of virtual applause. That everyone's presentations were really great, and just want to say thank you so much for giving that overview of your work. I'm sure we could spend probably 90 minutes with each one of you to go into more depth, but unfortunately we're a little bit limited for time. So yeah, let's get into a couple of questions and answers. Folks, please feel free to add your questions to the group in the chat. We will definitely try and synthesize them. One question that Caitlin actually just mentioned is, we talk about at a high level this work in these sessions. Oftentimes it can paint a really rosy picture, but we want to hear what challenges have you run into while doing this work? How did you work to overcome them? How did you build authentic relationships with your community? We want to get down into the day-to-day work, so let's try and do that. And I will call on you if you don't come off mute. No pressure.
I'll come off mute just because I teased it, I feel like. But yeah, I do think it's a really, really tough relationship in a lot of ways to sort of be in the position of a professional food system stakeholder, trying to figure out how to shift power, how to give up power, where to step back, where to step up, where to give more support. I think sometimes there's a really fine line between support and power and control, and it can be just really, really hard to navigate that line. I think that, one thing particularly with the Amherst mobile market that we've really struggled with is hearing from community members, we really want you to take a step back. We want you to give us more, freedom, more reign here. And we'll take a step back, and then, conflict arises and things start to go wrong, and there's a lot of challenges that come up. And then it's sort of coming back to us well, why aren't you supporting us? And so I think there's not a blueprint, there's not a really good blueprint for how to do this power shifting work, how to create space for leadership, non-traditional leadership, maybe I would say. And so we're messing up all the time, and sometimes we mess up and it's okay, we can fix it. And sometimes we mess up and it feels a little bit more irreversible. And so I just want to say, it's a really nice and lovely idea for professionals to really be trying to support community-led food system work. I think it's a great thing to do. I think it's super worthwhile. I think it's exactly what we should be doing, and it's extremely challenging. It's extremely challenging to know how to do it well. So I know there's a lot more I could say, but I'll stop there.
No, I think that's a great introduction. And, you know, no one is perfect, and we're each trying to do this work in a way that shifts power. And I think we have to recognize that there is some experimentation and learning along that path. Casey and Rick, do you want to add anything?
I'm also happy to, oh, go ahead, Casey.
Oh, just really quickly, I'll just jump in quick. I think one of the things that's been challenging, it relates across the board. I don't think it's specific to this topic, so I don't want to like take up the time, but I think one of the challenges we're really constantly thinking of is how to sustain support for doing the equity-based community engaged work from the funding community. I think there is so much misunderstanding or assumptions being made, I don't know what it's called, categorized exactly, about what it means to be food secure and what the barriers are, that there's still like a predominant culture in the funding community of like assumptions around, you know, oh, if we put produce in the bodega, or if we, you know, which is not a bad strat, but like, or if we, you know, oh, we just, you know, this simple point A to point B of access, you know, oh, you can get it, you know, you could, you know, that will solve the issues that we have, and being able to get the sustained support to continue to collect the community feedback, and to be able to like genuinely really engage and support movement building, that showcases this kind of more diverse landscape of needs and a much broader understanding of what these barriers are, has still remained really difficult to sustain.
Sarah, did you want to add anything? I'm sorry, we missed you earlier.
No, no worries. Sorry, I'm on the road. If you guys can hear me okay, I had to hop in the car. But yeah, I agree with everything that was said. If I were to add one more point, I think it would just be a big challenge is just the time commitment and what it takes to do some of this work. I think, you know, when we're trying to partner with communities and really supporting communities to own this themselves, you know, for them to do all of this work, you know, there has to be, you know, it's hard if there's not compensation or if there's something. I mean, people like Rick, for instance, puts in a vast majority of his time during the week doing this work, and so I do think there's a lot of stuff when it comes to capacity and the time and dedication that it actually takes, and that a lot of the people who we want to have at the table, those can be even harder to reach populations depending on what's going on, who are trying to juggle, I don't know, 2 to 3 jobs and have children. And so there's a lot of factors to go into it. And I think it's going to be a constant struggle, and you really have to kind of get support and weigh out the options. But I agree with everything else that was said.
Thank you. There's a question in the chat about reaching specific demographics or historically marginalized, I would call them, communities within your program. I think this was specifically directed to the Hampshire group, but I will open it up to everyone. I want to hear how you've reached these folks in your community that have been historically marginalized and excluded from processes on a more day-to-day basis.
So I can kick that off. Like I said, sometimes it feels hard to answer this question because it's not just one thing. It's not like one thing that we did one time or anything like that. I think particularly in the way that we do our work, we really try to think of it building on itself. And I almost think of it kind of like a spiral, like, you know, it's, I mean, I definitely think that doing project-based work, you know, an outcome like some of the outcomes Rick named, or the Amherst mobile market, or the community garden Kia named, doing that at a housing complex, you know, that's a great way to say this, there's something solid, you know, that we're working together on, that we'd love for you to get involved in. I also think it's so important to have trusted community partners that you're working with from the beginning. I would say, you know, particularly in Northampton and Amherst, we really kicked off a lot of this work with people who, by working with people who were really trusted by the community, who were asking folks to come to the table. but we do that, you know, in such a way, and you know, I think Kia could speak to this, and however else you want to talk about this, Kia, but that it's not just, okay, come build this community garden and all right, now we're done. Thanks, that was fun. Glad you participated. You know, come build this community garden and now here's another leadership opportunity. Here's another way to get involved. Here's another, you know, way for you to kind of like step up into the next phase of your role. So Kia, I saw you unmuted yourself. I don't know if you want to add anything.
Yeah, well, I was going to say that, you know, for me, it all started with the community garden. You know, like they had come to me and they said, how would you feel about a raised bed across the street? And I was like, oh, I love gardening. I'm all in. And, you know, once I realized that the project was pretty much directed at helping people to eat healthier and to have access to fresh produce, which, you know, a lot of the times with low income people, it's really hard to afford that kind of thing. You know, I was really interested in, you know, like helping that project to be a success. And then what happened after that was, you know, the nonprofits that helped put us together stayed involved with the community. And we wound up doing like Friday night potlucks with the vegetables we were growing, you know, like all kinds of things like evolved out of that. And then we had a training in sociocracy, which we wound up using in the Food Policy Council as our governance structure. So, I mean, they stayed involved. They made us feel like they really cared about what was happening with us and always were asking what we needed, how we needed it, how is the best way to serve you. And for me personally, the reason why I could stay involved at this level is because I'm a retiree. You know, I don't have a job to go to every day. So I feel really comfortable like representing my whole community because I'm involved with, like I talk to everybody, you know, so I can take everybody's feedback and I can come back to the Food Policy Council and explain what people need or what the challenges are. And, you know, I think it's the best way for me to be of service in this kind of work. But the thing is like Caitlin is right. If you have a project somewhere and you want to involve the community members, you need to follow up. You need to stay engaged with these people and see, you know, and make sure that things are working out. Make sure, you know, see if they need any other resources. Like there are all kinds of ways to stay engaged with the community. And again, and I can't stress this enough, as long as people feel like they are valued, they will be enthusiastic about contributing, you know, and this is really key. Like give people respect for their humanity. That's pretty much bottom line it.
I totally agree with what everyone's saying pertaining to that. I remember when I first started out, because I did so much organizing, you know, in Boston before. I met Sarah and Jen, I'm sorry, and we talked for a bit, and I was, you know, the way she expressed it to me was very exciting. You know, it's something where I, as a community member, could be involved, and my voice will actually be heard. You know, and having heard her say that, then she caught my attention. I got involved. But as far as keeping volunteers and other community members involved, I totally agree with making sure that they feel valued and making sure that their voices get heard. You know, that's why in our organization, what we do when we have meetings and stuff, like no single person makes, you know, we try not to make any decisions, you know, unless the community is involved. Sometimes there's something that, you know, a decision may have to be made like right there and then. We may do it, but then we'll send out an email or a text message or something, you know, explaining to folks what we had to do or whatever the case is. But community involvement, I think, relies a lot on them. People really having their voices heard, and time as well. You know, a lot of people are stressed out as well, not having jobs, and you know, the stress of waking up and not knowing where your next meal is going to come from, or next meal for your kids or something. You know, it's not that you don't have time, but you're so busy and stressed out trying to make ends meet and put a meal on the table. It's hard to get involved with something else. So, you know, just listen to their needs, help out personally when you can, you know. Sometimes you'd be surprised at what some of the issues that regular community folks will be going through, or, you know, and the little things that you may be able to help what they see as a big problem to them. So, you know, it's being involved, keeping involved in them. Like I have some subcommittee meetings that I run every other Wednesday, just to make sure that I'm in touch with community members and, you know, seeing how they're doing, any input about our pop-up or what we're doing, or, you know, I gather ideas and then I bring them back to a bigger group and we have discussions about them. Nothing's, no stones left unturned. Well, maybe some of them, but I try not to.
Awesome. Casey and Sarah, any last thoughts?
Mhm.
I don't think so.
Rick,
Appreciate
Rick,
being
got
on the
that one for
panel,
me.
such great
I'm good.
topics.
Thank you.
Yeah, me too. I feel like it's all covered. Thank you.
Okay.
I just want to quickly point to something that Rick said, which is about being clear about when you're making decisions, who should be in that room, right? And I think this is why we have spent 1.5 years developing the accountability structure, the governance structure, which is basically the accountability structure for the Food Policy Council, because we want to be clear how are decisions made and who should be making decisions together, and when can a decision be made and not be made without, you know, X, Y, and Z person in the room. So I just think that's such a great point, Rick, because I think without getting really clear about that, you're bound to just start making decisions on behalf of other people without even realizing it or thinking about it.
Definitely.
100%.
Yeah, I can say, sorry, just real quick, like one of the really successful tools that we engaged with over the last community health improvement planning process was that we held community conversations with folks to like identify strategies, and they were invite only community conversations based on very specific demographics of who was most impacted by the system-based issues that we saw according to data. So we narrowed those populations, and then you had a community cohort with connections in various communities that did invite only, and we tracked demographics and had a dashboard of exactly who was participating, and then checked in regularly and done what we called representation gaps of who was engaged. And that really forced us to be accountable to that, because I think we said, well, we held in conversations in a community forum, but like who goes to those, and how you really like, you know, making sure it's those who are most impacted.
Awesome. Thank you so much, Casey, for sharing that. All right, shake it out. Our presentations are done. We're moving into our breakout sessions now. Thank you so much again to our panelists, Caitlin, Casey, Sarah, Kia, and Rick. We really appreciate it. So now we wanted to give folks an opportunity to take the lessons that we've identified today back to your own work. So I'm going to put a quick set of questions in the chat. And Witten, if you want to open those rooms in a minute, feel free to do so. But we're basically asking you what you've learned. Does it make you think differently about your work? What resources would you need to do so? What are some obstacles that are there to you following through with those changes? And who are you not partnering with in your community who you think you should? Don't have to call out specific organizations, but just generally, such as like housing, anti-poverty groups. We really want you to have an opportunity to take this back to your own work. So let's open those rooms. We have a quick 10 to 12 minutes. Apologies that there's never enough time, but we want you to get into those discussions. So please get into them right away as we get into those rooms. So thank you so much, everyone.